In today's world, women have more options than ever before when it comes to fertility treatments, which would include freezing your eggs. But when do you need to think about this if you want it to be effective? It's time to talk to your doctor. Maybe now, maybe already. Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology is joining us this morning for a little health talk. Good morning. This is such an important topic.
Absolutely. You know, fertility, like every other thing in our culture, has trends.
Yes.
And so we're seeing changing trends, and we know women's lives have changed quite a bit. If you look over the decades, more women are in the workforce, more women are getting higher education. In fact, I think women are the majority of people in college these days. And where does family fit in?
Right.
Because unfortunately, what hasn't changed is that women still do the heavy lifting when it comes to making babies. And so it's so important for women to think about that as they think about planning the rest of their lives. So at the annual visit, it's one of the things that comes up. Most women are thinking about avoiding having babies, but definitely one of the things we ask is, what are your plans? What are your plans for having babies? Is it in the next year, 5 years, 10 years? What are you thinking about?
And it is an important conversation to have because it's actually during your prime fertility time when you may be hoping to put off having a family. But if, say, freezing your eggs or something that was going to be an option down the road, the earlier would be the better, right?
Earlier is better. Yes. But one of the dilemmas that women find themselves in, and families find themselves in your 20s, like I said, women want to avoid having babies, so that might be a little bit too early.
Okay.
But your late 30s might be a little bit too late, because one of the realities of biology is that women's most healthy eggs are when they're the youngest.
Okay.
And as they get older, the eggs are not as healthy and there are not as many of them. So if you wait too long, then they're not your healthiest eggs. So it's really a fine line finding that sweet spot. And of course, egg freezing is not cheap. So it's also, when can you afford it? Because at 21, you can't, even if your eggs are great, right? And so it really is finding that sweet spot of, when do I need it?
Okay.
Because by 35, lots of women don't need egg freezing anymore. They're using their eggs in real time.
How prevalent is infertility and the diagnosis of something being wrong that will keep you from naturally getting pregnant?
It really is age dependent.
Okay.
And so infertility in younger women is uncommon, most likely related to infections that damage the tubes. Infertility in older women is more common, more related to biology and aging. So it really depends on which age group you're looking at, what the issues may be. What I say to most women is that in today's day and age, as you talked about options earlier, anyone can have a baby if they have enough money, right? And so you have to think about what's going on in your life, what's the context of your life, what are your choices,
and what are your options going to be in terms of that?
Exactly.
Because you're talking tens of thousands of dollars for fertility treatments.
So sperm freezing has been around for a long time, decades and decades, and sperm is easy to get to, everyone knows, right? But eggs are not so easy to get to. You kind of have to take hormones to stimulate your eggs. Then you have to have a procedure to retrieve them. So it's not just money. It's time. It's an invasive procedure. So it's a real big decision, and it won't be right for everybody. But, you know, I want women to think about it as an option as they get older, as you're pursuing that PhD, you're becoming vice president of the corporation. Are children something you want in your life? What are your options for getting them?
Have the conversation with your doctor.
Absolutely.
And also maybe when you're taking a job, check out their insurance policies, because there are many major companies across the country that do not cover any fertility treatments at all.
But there are a few that do, so that is an excellent point.
Dr. Thompson, thank you.